Today on the show, ACCC's Capitol Hill Day. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. On the first day of the 51st Annual Meeting and Cancer Center Business Summit, or AMCCBS for short, ACCC will gather leading cancer care providers from around the nation on Capitol Hill to speak to lawmakers about issues that impact their patients. Here to share what to expect from the day is Nicole Tapay from ACCC.
We've definitely identified some priority issues, and they include drug shortages, which unfortunately continue to be a challenge. Patient navigation, which was a very exciting new Medicare reimbursement for patient navigation services that help people, work their way through the cancer care continuum, including at times financial navigation to make sure that they are accessing all the coverage and financial and transportation resources that may be available to them. There is a link between prior auth, unfortunately, and financial toxicity, which also remains a priority issue, which is basically all the times that patients end up having to pay out of pocket. And that burden is something that many centers help the patients navigate, but there's some hope that there might be some policy steps that could improve it. The Inflation Reduction Act is a large piece of legislation that passed a couple of years ago that includes many provisions. We are particularly focused on those that impact patient out-of-pocket costs as well as provider reimbursement. And there's some concern that in a couple of years, particularly for providers that provide infused medications to patients, reimbursement could be significantly cut under the provisions of the law. So that will be something that they'll be talking about in terms of the potential impact and hopefully finding a way to mitigate that. And then additionally, there's a handful of issues that were actually included in legislation, larger package of legislation at the end of last year that unfortunately didn't ultimately get enacted. And that includes telehealth, which right now will expire at the end of March. So they'll be talking about that, as well as some screening and detection legislation and coverage issues that they would like to see addressed. So those are our main issues. There's certainly enough of them to keep our conversations going.
Nicole, when cancer care providers visit the Hill in person, what kind of impact does that make on the members and the senators and the staffers they're meeting with?
It's a very valuable part of the process because, as much as I am a practice advocate, I can't give the firsthand experience that the practitioners and administrators running their cancer centers and serving and treating their patients. For example, one of our priority policy issues is prior authorization, which is when plans review providers' decisions and in some cases deny them and have to go through an appeal process. And that has been burdensome for the providers and at times resulted in treatment delays or denials for the patients. So that is actually our organization's priority issue. And as I mentioned, I think when they go up there, they will be speaking with firsthand experience of what those processes have meant for patients. And so it's quite powerful.
And how does Hill Day participation impact the ACCC members?
Yeah, I think they really enjoy it. I think they get feedback, through the questions that are posed from the Hill staff. They feel that they're participating directly, which they are, in the policymaking process in a way that is not part of their normal day jobs for the most part. And so they found it very rewarding. I mean, sometimes there's obviously the excitement of meeting senior staff and in some cases the members themselves, which is not an everyday occurrence. We break them up by region, and so people are meeting with their representatives in their state or nearby states. And so these are, sometimes a chance to meet people that they may have seen on the news or who are working for people they've seen on the news, but that they haven't had a chance to interact with before.
Speak to ACCC members who haven't participated before but want to, and they're not sure how to speak to government officials. They're not sure how to advocate for these issues.
I just really want to encourage everyone to join. And I think you touched on an important question. Some people who may not have had the opportunity to do it before, may feel uneasy for whatever reason, but I want to encourage them not to. We will do everything we can to make sure everybody feels well equipped to make the case on the issues that we're working on. And it will really help us to have a strong presence and hope that we get a good number of members joining.
Thank you, Nicole. There's still time to register for AMCCBS. That will take place March 5th through the 7th in Washington, D.C. Just click the link in the show notes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.